We have Rajeev Jayadevan, scientific advisor at the IMA, joining us. Dr. Jayadevan, thank you for joining us. Let me put a fundamental question to you, Dr. Jayadevan. Initially, when the second wave broke out, many doctors told us that it is perhaps less harmful than the first one. Now we are hearing that this wave might be more dangerous and more lethal with a higher mortality rate. Would that be correct?
Well, we must be very careful about what kind of information we choose to believe. Frequently, people like to believe what they want to hear, comforting news for the most part. We must really collect data and then make such statements. Overall, it is said that the new wave tends to spread faster. And why would that be? There are several reasons for that. For one, people are less careful this year compared to last year. Last year, everybody was careful. Everybody took their precautions to the most extent. But this year, you just have to look around any town to see how people are behaving compared to last year. That itself is the largest driver of the pandemic. So that's the single most important factor. The second reason is that the virus itself has undergone some changes all around the world. There are more and more papers coming from all around the world that the new forms of the virus, the emerging new forms of the virus, spread faster. So if you put the two together, the spread will be more. And when the spread becomes so much that the healthcare system is overwhelmed, and that is when your mortality starts going up. That's when the death rate starts going up.
So how does the mortality rates this time compare with what we saw last year?
Say that again.
How do the mortality rate figures compare with last year?
Yeah, the mortality rates for this year have not been published yet. But what is seen on the ground is, I'm talking from Cochin in South India. We have younger people admitted in the hospitals in the ICU now, as I speak. So the wave is affecting younger people, and within a few months we will have the mortality rates published. So it is very important not to comment on mortality rates looking at just very small numbers of people in one hospital. So we'll just have to wait and see about that. There is published information now that mortality rates may be higher among younger age groups than expected.
All right.
But again, there are many factors that may corrupt this information, including how good is the healthcare access.
Right. So the situation is grim. We'll wait for the mortality figures, but they may be higher, as you are saying. We'll have to wait and see. Now, the fact that children are coming down with severe symptoms this time, how much of a bother is it for India? Because as we were discussing in India Ahead earlier as well, we have a vast population under 18 years, or maybe 55 crore people.
Yeah, that's a very good question. See, right from last year, we've been believing all kinds of wrong information, saying that India is immune to the virus, Indians don't die from the virus, India is protected from the virus. That's all false. It's all, as I said earlier in our discussion, it is all the case of choosing what we want to hear. And the reality is, the harsh reality is, India is no different. Okay, so that is good. In one sense, it's good. We are no worse than the world in terms of our death rate. But India is a younger nation compared to the rest of the world. India is one of the youngest nations. In other words, our average age is very young, which means that if you take the population, a very large number of people are young. From that perspective, we must look at the role of children among society. And at this point, thankfully, children have almost no mortality compared to adults. I'll explain how it works. From the age of 1 to 14, the published death rate in children is 1 in 50,000. That's 50,000. All right. So that's the number of deaths that will happen if you get COVID-19 in that age group. Below 1 and above 15, the mortality starts going up, and around 35, 40 upwards, the mortality starts going up a little bit more, and 55 upwards, it takes a steep upward climb. So the graph works like that. So children at this point, we believe that they are acting as spreaders because they may take the virus from family to family, but by themselves, apart from a rare condition called MIS-C, which is what we talk about, it's an inflammatory condition, which is quite rare. Apart from that, there is not much of health concern for children. Long COVID is another concern that is coming up, but we don't have much data on long COVID in India in that age segment.
All right. And Dr. Jayadevan, another fundamental question. We have been debating this on India Ahead in the past as well. We know that the situation is very grim. We know that. But could we be still underreporting fresh cases? I'm just read out a very recent statement. In fact, it just come in from Maharashtra Minister Aslam Sheikh. Please listen carefully. Mr. Sheikh is saying, we have asked COVID-19 task force to study why cases are increasing only in Maharashtra and not in states where elections are being held. Many ministers are campaigning with mass gatherings there, but there is no surge in COVID cases in these election-bound states. How do you react to that?
I have often said, even from last year, that it is futile to try to compare COVID rates, that is case rates and mortality rates between different regions, because different states, different countries have differing protocols, and you can't stop it. That's the case all around the world. So I've emphasized this point so hard that it's best that each state compares their own data, because their system is pretty much uniform under the same government.
So, but sir, wouldn't you expect a relatively higher COVID surge in election-bound states?
It's difficult to say. The surge of COVID, it is not just dependent on election. This particular virus belongs to a family called coronavirus. All right, these are seasonal viruses. Season in the sense it doesn't really depend on the season, but a wave comes and a wave goes. And depending on the topography, the travel history, social dynamics, and locally circulating variants, and the number of vulnerable people in the region, and international travel and interstate travel, there are so many variables that affect how many cases are happening in each region. So election definitely is an amplifying factor, because everybody gets together in an election one way or the other. So, but it is not true that if you have an election, cases will go up. But there may be another state where election is not happening, but a festival is happening, or another state where the pandemic is actually having an active wave. So my point is, the wave, it depends on the region as well, but it also depends on what people are doing in that region. So if you're actually having a wave and people are behaving badly or dangerously, yes, the wave gets amplified.
All right, Doctor. And now we get the news that India is trying to introduce more vaccine candidates in the country. I think Sputnik is in advanced stage of approvals. How crucial is that in our fight against the pandemic?
As far as the scientific developments go, over the last year, I've tracked as many as humanly possible. There's only one scientific discovery that stands out, and that is vaccines. Now, what vaccines do is they reduce the chance of dying should you contact the virus. All right, you could still contract the virus, you could still pick up the virus after vaccination, but what happens after the infection is controlled largely by whether you're vaccinated or not. Now, if you're able to vaccinate everybody, then definitely the total mortality will come down.
Right.
So the sooner we vaccinate, the better. And as far as the ability to vaccinate each nation, that's a contentious matter. It depends on so many factors, of which I'm no expert in. But if there is plenty of availability and choice, it's all the better for the whole nation.
All right, Dr. Jayadevan, thank you for all those insights.